Ombud, Professor Malegapuru Makgoba, and from thereof we'll have an introduction of the Minister of Health, which will be done by the MEC of Health in Gauteng, Dr. N. Mokgethi, and then from there, immediately after that, we'll have the remarks by the Minister. After that, we'll hand over the report. The Health Ombud will hand over the report to the Minister, to the Office of Health and Compliance, to the families, and also to Tembisa Hospital. And from thereof, we'll take questions and answers. The questions, let us keep the questions brief. We'll have an opportunity to do the interviews thereof after the interviews. Thank you so much. You are all aware that we are releasing the report into the findings, particularly subsequent to the investigation that was conducted by Health Ombud into the care, circumstances into the care, and so also the death of Mr. Shonisani Lethole at Tembisa Provincial Tertiary Hospital. Without wasting any time, I'm going to hand over to our acting CEO, Malegapuru, to welcome everyone. Thank you so much.
Thank you, Mr. Masakanya. Good morning, ladies and gentlemen. And I just want to welcome you to this media briefing. And I want to acknowledge the presence of Gauteng MEC of Health, Dr. N. Mokgethi. Also the presence of Professor Makgoba. I also want to acknowledge the presence of the hospital management of Tembisa Tertiary Hospital and all the media people who are present in this media briefing. As Mr. Masakanya has indicated, the purpose of this media briefing is for Professor Makgoba to release the findings of the investigations into the circumstances surrounding the care and death of Mr. Shonisani Lethole at Tembisa Tertiary Hospital. Professor Makgoba, you are welcome to the stage. Thank you.
Good morning, compatriots, Honorable MEC, the Program Director, colleagues, ladies and gentlemen. It's my singular honor to stand in front of you and the larger public out there to present the findings of my report that I conducted around the circumstances of Mr. Lethole's care and his death at Tembisa Hospital. The main complainant was obviously the Minister of Health who lodged the complaint. However, there were other subsidiary or subsequent complainants that included the family, and I was told that one member of the family would be here, but there are about 25,936 social activists out there that also signed a petition asking the Health Ombud, I think, to address the issue of Shonisani Lethole's care and his death. So I'm going to be brief, just to highlight the main issues that have come out of the investigation. But I want to start my presentation as follows, Honorable MEC. Most of you who listen to music will know of an old man And one of his songs was that entitled New York, New York. I'm sure some of you remember the words. It starts by saying, start spreading the news. I'm leaving tonight. And it has got many verses. And I picked up the 5th verse that says, if I can make it there, I will make it anywhere. It's up to you, New York, New York. As you know, Mr. Lethole did not make it at Tembisa Hospital. But I think the analogy or the metaphor is very similar during the time when Mr. Lethole was admitted there. The investigation, as I say, was initiated on the complaint that was lodged by the Honorable Minister, Zwelini Mkhize. It was basically to answer the complainant's questions on the care and the death of Mr. Lethole. The second also to answer the questions of the family. The third was to respond and answer the many social activists that I've already mentioned that were campaigning for justice for Shoni. And as I say, on my last count, there were about 25,936 of these people that are all seeking justice for Mr. Lethole. And the final one was really try and fix that which was broke, if there was any, and to help them, I think, to develop and set them on a new footing. And I'm really honored and privileged to see that the management of Tembisa are here today to be part of receiving this report that I am making public today. So I've just prepared just a few slides. The major categories of the findings of my report are, I have to deal with the issue of the food that became the most important issue around Mr. Lethole's care and his death, the food. Because he had tweeted that he didn't eat for 48 hours. I want people to remember this. Mr. Lethole never said he was denied food. He never said where he was, where he didn't eat. He just said, Minister, I didn't eat for 48 hours. However, I think people started to put words into his mouth, into the media, saying that he was denied food. So I want to make that very clear. He never said he was denied food. He said, I didn't eat. And nobody knew where he didn't eat. I think the second finding, major findings, really deals with the medical care and his death. And the third one deals with the clinical records and the findings of his tests. Because I think the report is 202 pages with about annexures that are 62 pages on its own, I'm just going to give the highlights of the findings. So there are those 4 findings. Let me just touch on this. Here they are. It is the food, the medical care, the clinical records, and the diagnostic tests. On the food, if you want to remember one thing, it's this. Mr. Lethole was not offered food at Tembisa Hospital for 100 hours and 54 minutes. I don't know what's happening. Huh? Well, they eat into our time. Anyway, I can keep on talking. What is it? He was not offered food at Tembisa Hospital for 100 hours and 54 minutes. And this came in 2 tranches. The first was for 43 hours, 24 minutes, The second was for 57 hours and 30 minutes. The first failure to offer him food was when he arrived at the hospital on the 23rd, to the time when he got admitted to Ward 23 on the 24th around midnight, when he started to have food the following day. And he declared to everybody that he has finally eaten at Tembisa Hospital, and that time he was in Ward 23. The second time frame was when he was sedated, he was on mechanical ventilation, and nobody inserted a nasogastric tube, and this started on the 27th from 1 o'clock. He was never fed until he died. So that's the 57 hours and 30 minutes. That's really the main finding on the food. The second finding deals with the medical care. The medical care that was rendered to Mr. Lethole was categorized as substandard by almost every witness that we interviewed. But it has lots of elements of medical negligence that were found by the Health Ombud. Our findings were corroborated by the new head of internal medicine at Tembisa Hospital, and Dr. Farid Abdullah, who is an independent expert who looks after COVID patients at Steve Biko Hospital. And what he was given was the clinical records of the patient. He never interviewed anybody. He never visited the hospital. He just came to his conclusions from the clinical records that he examined. The same happened, I think, with Dr. Nwata. She never saw Mr. Lethole. She just was given a clinical record, and of course was given my preliminary report. However, she went further to say that Mr. Lethole's mortality was both avoidable and preventable, because he was a young man at 34 with no comorbidities. If you want to look at the report or the reports, I've put the pages there for ease of reading. The third finding deals with the clinical records. Really, these were described as defective. They were described as appalling. They had lots of falsified descriptions. Some days were missing records. Some were untimed, unsigned, illegible, and the records of the doctors were missing from the 23rd, 25th, 28th, 29th, and 30th. Let me make one point clear. I'm talking about doctors' notes, not clinical notes. And I specifically want to say this. Mr. Lethole died on the 29th, and I say there were no doctor's notes on the 30th. Why would I do that? Because he was certified dead on the 30th, and when you certify a patient, you have to examine the patient, you have to put it in the clinical records, and that's why the date of the 30th was there, and there were no notes that were available. Of course, the diagnostic test showed that he had the above tests, the X-rays, the ECG, the COVID test on the 23rd when he arrived in the evening. These tests that were done on the 23rd were never seen, they were never reviewed by the medical team, they were not commented upon until he died. And the tests on the 23rd when he arrived showed that Mr. Lethole had severe pneumonia in his chest X-ray. He had stage 4 renal failure because of his cellular filtration rate was very low. He had grossly deranged liver function tests. He had elevated muscle enzymes. He had elevated systemic inflammatory markers. And his SARS-CoV test was positive. And all these results were never evaluated and commented upon by the medical team that looked at him until towards his dying days. I'll just cut this short. Now let me come to the food, because eating is a very important thing for everybody. Tembisa Hospital, like all hospitals in our country, has something called a bed diet list, which is part of their standard operating procedure. This bed dialysis diagnosed as the hospital, the ward, the patient number, the name of the patient, the age, the diagnosis, and the code, the lunch and the supper, breakfast, and it's often signed by the sister who is in charge of the ward. The evidence that the investigator and myself were given, I will show you just now, it was really an untimed, unsigned a document that was actually unrelated to casualty isolation, and this could not be accepted as credible evidence. Now let me show you what a diet bed list looks like. There on the left hand side you can see that there are columns there of the normal bed diet list. You have the bed numbers, you have the names of the patients, you have their ages, you have their diagnosis, and then you have breakfast, lunch, and supper, and then you have the type of meal, normal meal, or salt-free meal, or a kidney failure meal, or diabetic meal. You have it as a column. And then you have the doctor who's in charge, and then at the bottom there, you have the signature of the sister who has ordered the bed diet list. On the 23rd and 24th, when we were looking for the evidence of that for Mr. Lethole, this is what we were given here on the right-hand side. An unsigned document that doesn't tell you where this was coming from, and it just gives you the total number of patients. So within that little thing there, I had to find out, is Mr. Lethole there? What was Mr. Lethole going to have for breakfast? And you can see that if you are really sitting there and saying, has this person actually received a meal, and you receive this piece of paper, I think you would find it very hard to actually believe that anything ever took place there. So that's the evidence that we were provided by the hospital. A piece of paper that is not signed, that doesn't tell you what Mr. Lethole was eating, what time this was signed, and who signed it. It's not there. However, here was an interesting one. After I finished my investigation, the CEO wanted us to go to patients that have been admitted allegedly with Mr. Lethole to bring some evidence that actually Mr. Lethole ate at Tembisa Hospital. They gave us about 5 of these affidavits. I've just chosen one, but in the annexures I've put 3 of them. Here was one person who signed an affidavit. I just wanted to show it there for the audience and the public. In this affidavit that was submitted by Ms. Magagula, she attested that she did not get any food on the 23rd and the 24th at Tembisa Hospital, and that their food services was very poor, and actually she lost a baby. And her affidavit was really not related to Mr. Lethole or casualty isolation, but she instead illuminated a situation that Mr. Lethole has spoken about, that the situation was unbearable and they didn't seem to care. That's what she said in that affidavit if you read it, but I'm not going to read it here. So that's the patient who had left Tembisa and had to give us evidence that actually Mr. Lethole had eaten. She didn't know Mr. Lethole. She was never at casualty isolation, and how could she testify that somebody ate when you've never been there? That's the piece of evidence that we were provided for by the hospital. The third one deals with another strange person in the hospital, which was a nurse who provided us with a progress note that both the CEO of the hospital and one of the clinical managers often recited, that this is evidence that Mr. Lethole had eaten. The normal nurse's progress notes, it's got a code number in every hospital. I think it's called TPH 114/2. It has 10 critical identifying features: date, time, report, signature, and so forth, diagnosis, page number. What we were presented for as the nurse's progress note to show that Mr. Lethole, it didn't have 8 of those features that are there. But I'll show it so that people can see that we are not just stating things. Here on the left-hand side is a typical progress notes. It has got a date, it has got a time, and then it's got where you write the notes, and then on the extreme side, that's where you sign. It's got the name of the patient's number, it's got the clinical person who's looking after the patient, it's got the diagnosis of the patient, and it gives you the number. That's a standard progress notes at the hospital. What did we receive to prove that Mr. Lethole ate? We received a document such as this. I call it notes for all seasons. It could be anybody's notes. It has got, first of all, it has got no name. It is not signed. It doesn't tell you that it belongs to Mr. Lethole. You have no idea what the diagnosis of this person is that you are seeing. More importantly, it talks about times from about 7. It doesn't talk about breakfast. It goes up into the evening. It doesn't talk about dinner or supper. And then somewhere in the middle, there's 1400, and the patient has tolerated lunch. But who is the patient? It's not Mr. Lethole, because we don't know that this is Mr. Lethole's document. It is just a patient that has tolerated lunch. That's why I call it a notepad for all seasons, because it can fit anybody, anytime, anywhere in the world, you can put it at. So that was part of the evidence that we received, that this man had eaten food at a tertiary hospital in our country. So here is the classic one. This is my favorite slide. This is supposed to show us the journey of Mr. Lethole. That starts at the extreme left at the top, where he arrives at the gate, and then he gets triaged, and then he gets admitted, or he gets received into the admission area or the isolation area, and then he stays there from the 23rd, and then on the 27th he gets intubated. Now, anybody who's an investigator or a detective will realize that Mr. Lethole's journey started on the 23rd, which is accurate, but it ended up on the 1st when his body was taken out of the hospital, not on the 27th when he was intubated. So between the 27th and the time of his death, Mr. Lethole was to be fed, but the hospital withholds that information from the public. It's as if the journey ended on the 27th, but they don't want to talk about the 27th, 28th, and 29th when he was alive. They should have demonstrated that they didn't give him food like they've shown there, that between the time when he was in Ward 23 and intubated, he received food. But after that, he was still in Ward 23 until he died. He was supposed to receive food. He never received food. So the hospital is smart enough to withhold information. The first thing that I want to illustrate is that Mr. Lethole arrived at the gate at Tembisa Hospital around 10:30, not 14:42 in the afternoon. Mr. Lethole was triaged around 11:18 by a nurse, and then 11:28 or 11:38 by a doctor. So the first part of that journey is inaccurate. But this is from the hospital management that has got the records, the clinical records, and they should be able to map that kind of journey. They then make a statement, and this is a contradiction in their own say. They say that Mr. Lethole was not admitted, so they were not responsible for his feeding. It was the family's responsibility. But in their own journey, they tell the public that he was fed on those days. So on the one hand, he was not admitted, he was not supposed to be fed because they can't provide the evidence of feeding. But when they project themselves and write a report to the former MEC and to myself, they project it as if this man had received food on the 23rd and 24th. He then gets transferred from that isolation area to the ward where he declared that he had eaten. So, in my summary, it was recorded that he was screened at gate 3 at 1442. This was actually an inaccuracy on the part of the leadership. Mr. Lethole was screened earlier around 11:18 and 11:40 by a nurse and an intern at the casualty. At 14:42, which is when they say he arrived at the gate, Mr. Lethole was actually having his vitals being taken in the casualty isolation by a nurse at 14:42. It's not when he was arriving. And then they make a claim that Mr. Lethole was seen by a COVID team. There was no team that saw Mr. Lethole. He was seen by a clinical associate when he arrived. So that is another inaccuracy. We know that I've already shown you that on the 23rd and 24th, the hospital never provided him with food. And their explanation is that, they don't feed people who are not admitted, although the people are kept there or they are detained there in the hospital for those days. And I don't know which common sense person would tell you, you go and stay in a hospital only to have your bloods taken, you are being given medication on an inpatient form, but you are not supposed to be given food. That's the sort of logic that is being applied here. So the senior leadership at Tembisa Hospital withheld information from my office and from the MEC when they prepared their reports on the 1st of July. Of course, on the 27th, Mr. Lethole was sedated, as I've said, and the hospital does not want to record what happened to him during that time, as I've already indicated to you. So these inaccuracies that I just found on that journey are repeated within a period of 5 days, one to the former MEC, another one to myself. But here is a classic. One of the senior nursing staff at the hospital, when asked by the investigator, have you provided Mr. Lethole with food? She claimed that she gave Mr. Lethole breakfast at 9:30 on the 23rd. Now the records, we all agree, including the hospital, that at 9:30, Mr. Lethole was leaving Kempton Park Clinic. He wasn't at Tembisa. But some nurse at that hospital claimed that he had already given him breakfast. That's how I think the system operates. Let me conclude by saying that Mr. Lethole, again, I've shown you, he was not offered food or a meal. There's no word denial, I want to take that out, for 100 hours and 54 minutes. Mr. Lethole also demised without knowing his COVID test. Mr. Lethole's tweet, the one that came out on the 25th at 2031, was just the tip of an iceberg. But what is important is that it was authentic, it was truthful, and really, I think it meant what it said. One of the things that we have discovered in this process was that Mr. Lethole, Tembisa Hospital was really not fit to be what it's and ready for the COVID pandemic. I want to conclude by just giving you, I've made 11 recommendations. I'm going to just list 3. The first recommendation is I'm asking the Honorable MEC, Dr. Mokgethi, to appoint an independent audit process to really conduct a competency and fit for purpose assessment of the leadership and management staff at Tembisa Hospital. I want this team or forensic structure to review and revise the hospital admission policies and processes. I want them to review the corporate governance structure at the hospital so that it is in line with Kim 4 corporate governance principle. And I also want them to conduct an appropriate climate survey assessment of staff and patients. I say this because during the course of our investigation, we found that the nurses and the doctors did not work together. There was no team spirit. Between the nurses were not also working together. The doctors between the doctors were not working together. So it was almost just like a zoo of people that are supposed to look after patients. So I think this needs to be investigated by an independent process. And then I make the following further recommendation, that in the light of these wide-ranging findings that I've spoken about, of the food, the medical care, the tests, and the SARS-CoV tests and others, and the clinical records of the hospital, I make a recommendation that really the accounting officer has to be taken to a disciplinary process for really running the state of affairs that is almost as it was. He really sidelined, I think, proper processes. He sent me and Dr. Bandile Masuku the wrong information that he signed for. There were notes that, as I say, of doctors that were missing that he never reported and never alerted us to them. And I think that should have been a courtesy, something at least to say, I'm sending you this, but there are these defectives, and he never did that. So I think on the basis of that and many others that I think when you read the full report, you'll find, I think we believe that he should undergo a disciplinary process by the appropriate processes and not through my offices. We also believe that the Gauteng Department of Health and Tembisa Hospital should undertake disciplinary process against 19 staff members that you can characterize them as medical doctors, people that are in charge of food, and the nursing staff. They are all listed, I think, in my report, and I think it would be useful, I think, when you read the report in the media brief, I think they're all there. 19 staff members have to undergo discipline for whatever they have done. I am aware that some of them have already apologized, but as the person who made the findings, I'm not the right person to judge whether their apologies are what I should consider. I think it should be done by a separate process. I think that's one of the beauties of the South African Constitution, is that we all share the burden and become independent. I think finally, I want to make 2 points. Tembisa Hospital is classified as a tertiary level hospital. I believe it should not, it doesn't fit that level. It should be reviewed. I also don't think that the hospital was ready for the COVID hospital, despite the fact that when Mr. Lethole was admitted, we were already 3 months into the pandemic, and there had already been several warnings about what to do in this pandemic. There were, I believe, systemic faults in Tembisa. I don't think anybody doubts that, and they are recorded in our findings. However, the management of the establishment had not done their job, and I think it comes through everywhere in the report. More importantly, I think individual healthcare professionals involved in providing care also failed to discharge their responsibility, and their conduct could not be explained by the broader systemic defaults. I want to emphasize that. We know that the system is constrained, as we use the term in ESCOM. We always talk about a constrained system. The health system was also constrained, I think, in relation to this pandemic. But that does not absolve individual health professionals to do reckless things. Let me give you a very simple example. When you intubate a patient, you want to be able to be certain to know where you have placed the endotracheal tube. I'm sorry, the tube that you are going to use for mechanical ventilation. That's the endotracheal tube, yeah. When you intubate the patient, you know that they are going to require to be fed. You should put in a nasogastric tube for feeding. Now, those two things are just simple, basic, good care that you can't explain them on the basis that the hospital is busy, because you are doing it as a doctor. You have to do it the right way for the sake of the patient. That's the first example. The second one is, if you know that you can't care for a patient in medicine, and you know that Steve Biko or Mill Park Hospital can care for the patient, as a care professional, you are supposed to advocate for the patient and say, look, we can't look after this patient here. Somewhere else they can look after the patient better. I say this because whenever we asked the witnesses, if you had a relative who was suffering from the same conditions as Shonisani, would you have wanted them to be looked after at Tembisa Hospital? Without exception, all of them said no. And when we asked why, they said because the condition of Mr. Lethole was not compatible with the facilities that they had at Tembisa. So there was a mismatch between their ability to care for him, but nevertheless, they kept on carrying on. So that's why I'm saying some of these things, you can't explain them on the basis of the system. You can only explain them on the basis of professional ethical codes. I hope that the recommendations I'm making in this final report are meant to encourage and foster a culture of high-quality healthcare, which is what we want in the NHS, our system. We want to foster a culture that respects the dignity of patients, because sometimes when we were doing our interviews, we didn't feel that there was dignity. Not on a single occasion when going through 113 interviews did I ever hear a witness say, I'm sorry. The only witness who ever said, I'm sorry for the loss of life, was actually the CEO of the hospital. He was concerned about the loss of a young life. But other than that, all the other people wanted us to exonerate them. That's what they were looking for. So that's what we are trying to foster by producing this report. We want establishments that respects the prescribed norms and standards of the national health system, and a culture that will be consistent with the ethics and the codes of good clinical practice. Finally, I want to leave you with this message. There is only one version of the truth when you conduct an investigation. There are not many versions. The truth does not have multiple versions or multiple shades. It's got one shade and one version. What we discovered, I think, during our investigation was that people were trying to give us multiple versions of their truth. And sometimes those versions didn't coincide. And we had to sit through to decide as to what is the actual truth. Let me give you one little example. Mr. Shonisani Lethole died on the 29th at Tembisa Hospital. Of course, his father believed he died on the 27th. There are reasons for that. But in the hospital itself, there was a group that believed he died on the 28th. And they would swear that he died on the... These were nurses, doctors. They believed he died on the 28th. And then there was another group that said he died on the 29th. In the same ward, small ward 23, you have health professionals having this kind of thing. What did we have to do? We had to go to Telkom as investigators to say, Telkom, can you give us a log details of which telephones came out of this ward to the family, to the Lethole family, to show how we could correlate those with the time when they actually called the Lethole family to notify them that Shonisani was no more. That's the level of too much work for important information, but did we need to do that when there are sisters and doctors in the ward and there are records that could be kept to say this was the date and everybody knew that? We had to go through that exercise, a couple of days going to Telkom, trying to find out who, until we located that Mr. Shonisani had actually died on the 29th at about 10:30 in the evening, and it was recorded because the operations manager of the ward called the father at about 8:50 on the 30th to come and break the news. But you heard about maybe 15 people contesting. No, it's 28th. No, it's 29th. No, it's, it was quite amazing. So, on that note, Program Director, I want to stop and I will take questions. There are many findings that I didn't want to go through because, as I say, it's a 200-page document. We have gone to every corner to establish and verify the truth, and only one version of the truth. Thank you. You can repeat the
Okay. Oh, thank you so much, Prof, for the presentation of the report. I'm now going to hand over to the MEC so that she can also give some remarks as well relating to the report. Thank you so much.
Startling there, the 27th, the 20th.
Thank you very much, Program Director. Good morning to Prof. Makgoba and to the senior management of the Tembisa Hospital and to the Lethole family if they are present here. Good morning. And to our people of Gauteng. Unfortunately, Prof, the minister had to rush to KZN, so he will not be here to receive the report. And as we all know, that the minister is the one who initiated this investigation, so this report is actually the minister's report, but the recommendations have to be implemented at the provincial level. Maybe as I'm representing the Gauteng Department of Health, Prof, just to say that this report, as you correctly said, is a 200-page report with annexures, and I think it will only be fair to afford us an opportunity to go through the report and see how best can we implement the recommendations of the report. And maybe to the Lethole family, to reiterate what the CEO of Tembisa Hospital said to you. I am also sorry for the loss of life of a young man who had a promising future. But I hope, as the Prof have said, as a Department of Health, we'll learn from this, Prof. We will be able to, I think, to strengthen our quality healthcare unit in making sure that each and every recommendation that is in the report is implemented as such. And maybe, Prof, to respond to your words when you say there are about 19 individuals that need to be disciplined. We will be able to do that. We'll afford everyone that is implicated in the report to clear their name within the confines of the law. I think I would end it there. Thank you very much, Program Director.
Thank you so much, MEC. I'm now going to hand over to Prof, the Health Ombud, to hand over the report to the MEC and also to the family, as well as to the chairperson of the Office of Health Standard Compliance. Yeah, he's here. Can we please, come this way so that we can hand over the report?
I just wanted to again explain a little bit. Part of this process is to publicly hand over hard copies of the report, often to the complainant and to the people that are going to carry the process forward, like the OHSC and the respondents, which would be Tembisa Hospital. So, as I said, that this is a very heavy report, and also I just want to acknowledge that this report would not have been possible without the tireless efforts and work of Ms. Helen Petona, who is the senior investigator for health cases at the Office of Health Standard. I'm really enormously grateful to her for the work that she has done, and all the people who contributed, I think, to the report. So I have to give it so that the public of the country recognizes that there has been a report. And let me start with Tembisa Hospital. You can see, that's your report. Give it to Mr. Lekopano, Dr. Lekopano. Me, this is your report. And I think this will be your report. This is my classmate at school, Dr. Kinoshi. He used to be in the province.
Thank you very
And
much.
who else is here? Who else? I've given the first.
Oh.
I think that's the ministers. And I think that's about it. Yeah. I think we have that. We have given the complainant, who is the minister. We have given the family, who are also the complainant, but also they are the ones that have suffered the loss. We have given Tembisa Hospital, who are the main respondents, because there are many other respondents. And we have given the MEC, who is going to be the person in charge of, making sure that things are done in terms of the recommendations. And we have given it to the chair of the OHSC, I think, whose role is to ensure that the recommendations are followed up and are done. That's really what we need to do. And that's why we do it so public, because the work we have done here is not a secret. It's in the interest of the public. And that's all that we've done. Thank you, all of you.
Thank you very much. Thank you so much, ladies and gentlemen. Now that the findings are out, the report is also out. This particular report will be available on the OHSC website and also the Health Ombud website. The OHSC website is www.ohsc.org.za. The Ombud is www.healthombud.org.za. I'm now going to take questions.
Maybe ask. Don't run away.
No, we're not done.
I'm now going to open the floor for questions. But I'm not going to take a lot of questions because we're still going to do the interviews outside for the media. I've noted 1, 2. I'll take 2 for now. Can you, in that order, 1, 2.
My name is Manu Gerobwe from Eastern Africa. Prof, can we then say that Mr. Lethole died because of negligence at Tembisa Hospital? You also mentioned that there was a patient who gave you an affidavit. I don't know whether on the 23rd and 24th, I did not actually get what you were saying, whether the patient said Mr. Lethole had been fed, even though the patient was actually. Can you just clarify that for me? About who's deleted that? Thank you.
Okay, let me start with the patient.
Yes.
When I finished my investigation, I submitted a preliminary report to the hospital. Clearly, the hospital read about this whole food issue, and they didn't feel that they had given us sufficient evidence to show that they had fed Mr. Lethole. They then requested whether we would be amenable to receiving further evidence from patients that might have known Mr. Lethole. And as you can see, it's ethically not right for people to go and look for their own witnesses, but we said, in the interest of transparency and openness, let's have them. They sent us 9 affidavits. 4 of those were actually nurses in the hospital. 3 of those we had already interviewed, and they had confirmed that Mr. Lethole was fed. But he was fed in Ward 23 when he arrived there on the 24th. So the issue of when did he eat was never in contention. But I will also tell you a little story. When Helen first arrived at the hospital and said that she's investigating this food issue, they told her, this man has had some food. She asked where. They said, Ward 23. So something that was not in contention from him and others. But what were they doing? They were actually hiding the fact that when he was in isolation area, that's where he was not fed, which is when he arrived there on the 23rd and the 24th. So the hospital needed to give us evidence from patients that had left the hospital that would have been with Mr. Lethole at casualty isolation on the 23rd and 24th, because from the 25th, there was no debate about it, we all agreed. But what they did was they provided us with 5 affidavits. None of the people there were ever in casualty isolation. None of them knew Mr. Lethole, and none of them could vouch that he ever ate, or some of them told us they didn't even get fed themselves. So they compounded the problem rather than resolve the problem. I think that is the first. The second question you raise is whether Mr. Lethole died from negligence. I think I'm going to put it this way. When I was conducting the investigation, there were many areas that I identified that constituted medical negligence. Okay, but Mr. Lethole, as I indicated, when he arrived on the 23rd, he had systemic, severe, overwhelming SARS-CoV-2 infection. And remember that he arrived on the 23rd. It wasn't until the 26th that he was seen by a certified medical doctor at a tertiary hospital. I didn't bring that as part of my findings. So you arrive at the hospital on the 23rd at about midday. You don't see a doctor until the 26th at about 9 o'clock. And you have severe COVID infection. So by that time, because his kidney functions had not been attended to, in fact, they didn't even know that, the doctors that were looking after him. They didn't assess his chest x-rays. They've never seen them until we're interviewing them. So let's take it that he had overwhelming COVID infection that was compounded by, I think, these episodes of medical negligence. I would not say that he died of medical negligence. That would be inappropriate. In fact, in my own findings, I said that had they attended to this issue, and maybe I just wrote the English slightly differently, I said his outcome might have been different. Now, but what is the outcome that is different from death? Is being alive. Of course, the then head of the current head of medicine was much more forthright. She said this was preventable and avoidable. But you know, that's how I think doctors will operate. I hope I've clarified that.
Thank you.
Can I take that other question, please?
Actually, well, I think the answers that Professor Malegapuru Makgoba gave to Malegapuru actually answered my questions.
Okay. So, there's another one there? In that order, 1, 2.
Simple Sturman from SABC TV News. Prof, have you received any other complaints relating to poor treatment of patients at various hospitals? You may be still investigating that, but I just want to get a picture of if there's been any complaints and just the state of the hospitals in the country in terms of what you're receiving from the public. And also from the MEC, you know, the conclusion there, as we see on the screen, we're told that the tweets by Mr. Lethole were quite accurate, and the findings, you know, are quite damning. As the Minister of Health in Gauteng, what's your immediate reaction after seeing all of this? That you know, a patient was not fed, he did not see a doctor for a number of days, admitted on the 23rd, and it would only be days later that he gets attended to. So, what's your immediate response to that? And how can people have confidence in these public health facilities if these are the horror stories that we hear? And this one is a lucky case because it actually got attention. I can imagine there's many more others out there that don't get this kind of attention. Thank you.
Let me answer your first question. You know, the national health system of our country is made of an infrastructure, and it's made of people, and it's made of policies. So you have the policies and the people interact in the buildings to create the national health system. You have to ask yourself, where are we excelling in these three sort of, there may be other elements, I just want to list the big ones. The policies of our national health system, as you know, are based on a new constitution, and they are supposed to be fair, equitable, and robust, and they can stand the scrutiny. So our policies are very good. Our infrastructure is, I would say, if I had to categorize it in terms of excellent, medium, or bad, I would put it at medium. I don't think our infrastructure is as bad as sometimes we exaggerate it. I think the biggest elephant in our room is the people. I think we need to create a new culture of training our nursing staff, our physiotherapists, our medical doctors, our specialists, and so forth. Whether it is driven by money or by the rewards or so, I don't know. But we do have a very serious people's problem, I think, in the health system that we need to address. And this is a profession I come from, and this is a profession that has brought me up. So I'm very proud of the profession. But I would like, I think, the younger generation to see the profession as a calling rather than as a money-making business. But there seems to be a preponderance of the money-making business rather than the calling. Some other people might comment better, but I have noticed that change over the years, that you know, people, as soon as you say, can you do this? It's how much are you going to pay me? In our time, if your boss said do this, you didn't ask. You thought, oh, what an opportunity, you know? We used to work from Friday up until Monday evening on call without complaining, because we thought, this is an opportunity to learn. But I can tell you today, if you said to somebody, work from Friday to Monday, they're going to calculate the hours and they will charge you for that. So there's a difference that has appeared over the years, and I think we're all struggling with that. And our country is not alone in that. I think many other countries are struggling with the youth. But you know, the thing that fascinates me this is a digression, but if you go to Oxford, you have children of the most rich, sophisticated people coming to the university. When they go for lunch, supper, they wear a uniform, a gown. You can't write an exam at Oxford without wearing a gown. Now, you can imagine if any vice chancellor ever said, you know, for students at my university, they must come wearing a gown, or for you to come to the dining hall, you must be wearing a gown. I'm sure they would be toying everywhere and breaking things. Because what they don't realize is the wearing of the gown has to do with the values of the system. That's all that we're trying to show, that we value certain things that don't cost money. So I just want to give those kinds of examples. As I say, you'll see lots of young people at Oxford who come from very wealthy families, but they still follow the values of the system. Here, if you said that, you are faced with a toy, and they can even come and burn your house. But you know, that's what we have to deal with. I hope I've answered you, sir.
Thank you very much for the question. And I think I did mention earlier that it's a 200-page report with so many annexures, and I've requested that we should be given an opportunity to go through the report. And I think Prof made about 3 key recommendations. In one of them, he recommended that I should appoint with immediate effect an independent audit leadership that will be able to audit the competencies of the people that were implicated in the report. But I think it will generally go to everyone that is in the hospital. So I'm committing to that, and I will be able to communicate after I have studied the report, so that I can also, because this happened when I was not even there. So I really need time to go through the report and be able to see how best can we implement. But what I can assure the family of the Lethole is that we are going to implement all those recommendations as they are. Thank you very much.
Okay, thank you so much, MEC, for the commitment. Now, I'm going to take the WhatsApp question lines. And then I'll afford you the opportunity immediately after the WhatsApp line. Can you please read the WhatsApp questions? Thank you.
No, thank you, Program Director. On the WhatsApp line, our first question is coming from Craig Nicholson from Daily Maverick. And the question is, Prof, you have recommended disciplinary charges against Tembisa Hospital staff and officials, but do you think further actions should be taken, such as recommending healthcare staff to be removed from their respective industry bodies or potential criminal charges? And the second question is coming from Nazir from Glow TV. And the question is, given the Deming report on Tembisa Hospital, what are the recommendations made to ensure such things do not ever happen again? Does the Ombud have any powers to implement proactive measures to ensure such incidents do not happen ever again in our hospitals in South Africa? And the following question is from Mariska Kotsiet from The Citizen. He says, Shonisani Lethole is not the first person to suffer at the hands of Tembisa Provincial Tertiary Hospital staff. Tembisa Hospital doctor is alleged to have switched off the life support machine, keeping Lloyd Kacheche in Ward 20 ICU alive on the 8th of December without family's consent. And to date, no comment from the department despite several attempts by the citizen. And Program Director, I have several questions from Samkele Maseko from the SABC News, and they are as follows. And considering the factual disputes arising during the investigation, did you afford any of the implicated officials an opportunity of cross-examining those implicating them as provided for in the Act? And the other one, have you interacted with the Minister of Health or the Premier of Gauteng during the process of the investigation? What was discussed in those interactions, and have those interactions not compromised the desired independence and impartiality of the Ombud as called for by the legislation? And he continues to say, we understand that, and he said, maybe the last one, he said, we understand that your function does not include publicizing your reports in the manner you have done with the press conference. What has been the rationale for your taking of this unprecedented step? I think we should stop here for now. Thanks.
Yeah, no, stop here for now. Okay, thank you so much. Prof, can you please respond to those ones?
I think for Samkele Maseko, I just have to start with the last question. Every report and investigation I've done, I've released my reports publicly, so this is not the first one. But more importantly, the public protector does investigations and releases her reports publicly, because we all act in the interest of the public. Interacting with people does not subsume your independence. The reasons are manifold. The minister is my boss, and the minister is the complainant. There's no other way I can avoid not interacting with the minister. But here is what I would say. The minister has never said to me, Professor Makgoba, I've asked you, what have you found? The minister has never come to me and said, oh, you are telling me this, why don't you do it this way? It has never been like that. I've worked with Minister Mtsoaledi, I'm now working with Zweli Mkhize. Both of them have, whenever there was a need for an interaction, like for example, before I had to release this report, I had to brief the minister because he was on the one hand the complainant to know what's happening. But that in no way, I cannot go into my report and say, this is what the minister changed in my report, or this is the minister suggested. All I know is that the minister said, okay, listen to you, I've heard you, it's your report, and that's all that I've ever had. So my independence as the Ombud has never been compromised by the people that look after me or who are supposed to be my superior. So I'm not sure what are the other questions that people raised on this WhatsApp, because they seem to be just too many. Can you just read them for me? I'll answer them one by one. The chap who read the WhatsApp, just read them for me. Just read one and I'll answer it quickly.
Okay, thank you, Prof. The first one was from Craig Nicholson from Maverick, and the question is, Prof, you have recommended disciplinary charges against Tembisa Hospital staff and officials. But do you think further actions should be taken, such as recommending healthcare staff be removed from their respective industry bodies, or potential criminal charges?
First of all, I don't think I have the power to do that. But more importantly, I can only recommend on the basis of my findings. I cannot go beyond my findings to recommend something that I dream of or I like. I'm not supposed to be working on that. I'm supposed to make findings, and those findings are supposed to be based on science and medicine, and they should be legally tied, and that's from there I've got to assess what sort of findings I make. The second important thing is this, as I've been saying before. We work in a system that is driven by values. And when you make recommendations, you make recommendations that are entrenched within the values of the health system. So the values of the health system are to care, to respect, to provide people with information, and so forth. So as you do your recommendations, I think you have to balance all of those things. So on the basis of that, I don't think I've got the powers to recommend people to be removed from their associated bodies. That would not be within my scope. The next one?
The next one, Prof, was that given the Deming report on Tembisa Hospital, what are the recommendations made to ensure such things do not ever happen again? And does the Ombud have any powers to implement proactive measures to ensure such incidents do not happen ever again?
I think the last question is the simplest to answer. The Ombud has no power. The world is full of many different people, just like we're here. So you can only make recommendation to improve. And remember that when you make the recommendations, you are not necessarily the one who's going to be following up all the recommendations. So you depend on the value system and the culture within the system that we work within. And you do this in good faith and in good trust. You know, lots of people in South Africa use very strong terms like damning. These findings that we have made obviously reflect an aspect of our national health system. And what we should be doing is to say, this report, if we agree, it provides us with an opportunity to improve and to move forward. You know, you can't all the time think, oh, because it's damning, then it means something, everything is negative, or you must go to the extreme of what you do. I think at the end of every darkness, I suppose there is a light at the end of the tunnel, and you look at the light if you want to move forward, and you improve on that. So it is meant to foster a different culture from what you have found when you were doing the investigation. That's all that we were doing. That's why the investigation of the Health Ombud is based on one version of the truth. That's all. Another question, if there is?
Another one, Prof, was from Mariska Kotse from the Citizen, who said Shonisani Lethole is not the first person to suffer at the hands of Tembisa Hospital. He said at the same hospital, the doctor is alleged to have switched off the life support machine, keeping Lloyd Gacheche in Ward 20 ICU alive on December the 8th without the family's consent. And there was no comment on this issue.
I'm not sure what I'm supposed to say, because I often make these very ridiculous examples that in every society there are many people who are thieves, they steal. And if you catch one thief, you deal with that thief and you deal with them effectively. You don't assume that because there are many thieves, everybody is a thief. You know, you may even find that your best friend is a thief, but he doesn't tell you. So I think we have to, as I say, you have to balance these extreme views to what really naturally happens. So I was requested by the minister following a complaint, and I think it had been discussed with the former MEC that I should investigate it. And my investigation is focused on that. I didn't go to Tembisa to find out, are there rats in the hospital? Are there mosquitoes? Or because I could do that, maybe because I'm investigating, but I had to focus in order to answer the questions of the minister, the questions of the family, and the question that the hospital was concerned with. And this was around Mr. Shonisani Lethole. That's all that I had to do, not to look for every other thing that might be happening in that hospital. No, that was not the purpose of my investigation. But if I'm asked for another case, I'll pack my bag and get Helen and I to go back somewhere else if we can do it. That's all. Okay.
I'm going to take the last two questions, and then from there, we're done.
Okay.
I thought, yeah. You shoot first.
Okay, cool. Prof, I'm not sure if maybe you could answer, but probably the MEC could be the one to answer this question. We've seen a lot of, and we've seen and heard a lot of stories, horrible stories about the public health system, whether it's in the province. Sorry. Oh, sorry. My name is Maseko Rashaha. I work for ENCA. MEC, we've heard a lot of stories, horrible stories about the public health system. The professor also saying that this is something that we could probably look at and try and move on from. But every time we hear stories like this, and there are reports such as this one, we never hear about the officials that are implicated being dealt with decisively. It's as if families always feel like the officials keep their jobs and they are allowed to carry on with their lives while they cry for the loss of their family members. So I want to know if anything of that is going to change. Is it according to law that all the families can do is sue the state pays, but the healthcare workers continue with the jobs? That's my first question. And then the other one is to you, Professor Makgoba. I know that you said that you can't necessarily comment or decide on criminal charges possibly being instituted, but your report says that the Tembisa Hospital withheld information. Surely that is something criminal. So, you know, your response to that part, at least, with your report finding that there's information that they withheld about him receiving food over a 3-day period.
Well, what I can do, or what I will do, is to report it to the appropriate authorities. That's what we do. For example, even these people that I've asked that they undergo disciplinary, these health professionals, I want them to undergo that process, and it's only when they have undergone that process and they are found guilty that it can be elevated to their health professional council. So I think there are these processes that limit your power, and you can't become too powerful in South Africa. I think we have learned that, because there are these checks and balances. So I can only say, if I believe that there is something criminal, which I've indicated in my report. For example, the loss of medical notes is something that should have been reported to the SAPS. I mean, that's what the law says. So I've put it out there as a finding, and obviously the hospital and others, they will look into that kind of matter and address it. Yeah, but you know, as an ombud, somebody complains about, is your independence compromised? Are you not toothless? So you have to balance all of these things. But at the end of the day, I really want to leave all of you with a message. The health system of our country is based on values. And we have to get the values of our society as best as we can. You can pour as much money as you want. If you don't have the values of the people that practice there and the people that come there, I think you are in for a loss. Sometimes the professional gets abused by the patients. So we have to protect the professionals as well at times, because they get abused in the system by patients. And finally, I really think that the job of part, an element of the job of my work, is to try and promote values without being very dictatorial about it. I generally don't want health complaints to go to the courts. It's not that I don't understand that, but if patients or patients' relatives want to go to the court, I recommend that they don't come to the office of the Health Ombud, because that's not our job. The job is not to become a license for you to go to court and say, because the Ombud has said this, then it must be right. I think if you want to do that, just start afresh somewhere and go to the courts and deal with it in a very legalistic manner. I think the offices of the Ombuds everywhere, they deal with values, ethics, morality, and so forth, in order to solve sometimes very intractable problems. Now, you can imagine in the life of many incidents where you have 144 people that have died. If each one of those went to court, I don't think the Premier, the former Minister of Health, would have ever had time to do anything but to spend their time in court. And by recommending a mediated problem that was conducted by Justice Museneke, we were able to bring people together to bond and share experiences. And some of them found closure, not everybody, but some did find closure. So that's really the big difference. I think Malungela is...
Hi, thank you. Maybe the MEC can answer this question. Okay. Because when you're making your report, Professor, you said that it was the hospital CEO who said sorry out of the people that you interviewed. Now I want to find out from either the MEC or the CEO. Are you, by saying sorry, are you then admitting that you killed Mr. Lethole? Thank
you. I think that's the last question, correct? So then I'll afford the MEC to answer those two questions, and then from there, yeah.
I think I can help the MEC, but let her answer. You know, let's understand what the CEO does. First of all, the CEO is operates at the level of strategy. He doesn't see patients. So sometimes things happen at the systems level where he has absolutely no control. But the CEO is human. I think we must understand that. He is human. And by saying to the family or saying to myself that he is sorry for the loss of life, I think he shows humanity. He's not taking responsibility. He's showing humanity that something that should not have happened in my hospital has happened, but not to take the responsibility that he is directly responsible for that. So those are things that I think should be distinguished, but I will let the MEC answer. I just think that to blame the CEO on that level, I think it's a little bit going too deep. Move in microphone. Otherwise, we go up and down.
I just want, Malungelo, I think the Prof has responded to your last question. I just wanted to read the message from one of the patients who was admitted recently at Tembisa. Okay. Maybe just to say, Masiho, I don't think it is fair to brush everyone with the same brush to say the services at the public health are so horrible. And I think our health workers, there are some of those that are doing their best, the Prof, to save life, and especially now under the COVID, that is the pandemic that is currently in the world and in our country. So there are those that might be negligent at some time, but there are those that are learning from the mistakes that they do. To the Lethole family, I think some of the nurses have learned from this in Tembisa. I just want to read the message of one of the the people who were admitted in the hospital. This message was written to the minister. He says, "Hi, Buti, I am admitted at Tembisa Hospital." And then he says, no, he says, "Hi, Buti, Zweli, my aunt is singing praises for the care at Tembisa Hospital. She is praising the attention to detail by the clinicians. She is very happy with her improvement. She is also very happy with the accommodations and ablution facilities. She says in the time she's been admitted, she hasn't seen a death. Thanks so much to your leadership." So what I'm trying to say, I'm not saying what happened is what's supposed to have happened, but I'm saying, as Prof have said, sometimes things happen for us to be able to improve our quality of healthcare. And it really shows that there are those people, maybe Prof, that have learned their lessons through this process. And I don't want us to just brush everyone with the same brush to say the services in the hospital, public health are horrible. There are those that are really trying their best to make sure that they save lives. And I think we will be able also to learn from the recommendations that Prof has done to us to improve the quality of healthcare in health services. Our health workers are currently very fatigued, but they are trying their best to make sure that they save their lives. And I am also saying we will be learning from this report, and we are really will be working with the family to make sure that each and every recommendation that is in the report is implemented. If there are people who are supposed to go through disciplinary processes, that will be done, and it will not be done in secret. That I can assure. Thank you very much.
Thank you so much, MEC. Colleagues, thank you so much. We've now concluding our briefing. Thanks for coming. You all have the report. The media statement is also issued, and also copy of the presentation. They're also accessible on the website. Thank you so much, and goodbye.
Thanks, Program Director. Program Director.
Are you doing it inside here? You doing it inside here?
Yeah, I think it's better here. Okay. With the breakdown. I think we can lower down.
Yeah.
Siba, lower down.
What are you doing?
We need a mock with him for 3 o'clock.
But can lower the screen. You can lower the screen.
Grab the family Thank you. I just want to check if the family can talk to us.
Yes, Jonathan, how are you? I can't are you saying
651.
Okay.
Basically, what I'm saying is basically what we'll be speaking on. What was today about, and as the MSc.
What does she make of it?
What's your point? What you find?
Okay.
That's fine.